Today's topic is Understanding Cannabis as Medicine. With me is Amy Green, RN with MMTC of Florida. So let's talk about cannabis as medicine.
Absolutely. Patients range from young adults to seniors, and they are treating everything that you could imagine. We're seeing veterans and athletes, and seriously, a lot of working professionals. Everybody has a different reason for using cannabis, but a lot of people are finding that it has medical benefits for them.
It's really becoming not taboo anymore and increasingly accepted, for treating a lot of different health issues. I think a lot of people worry about, you hear about opioids, you hear about different medicines that are out there that literally can kill you. No one's ever died from using cannabis. Is that correct?
That is entirely correct. Yeah, cannabis has no lethal dose. You always give the anecdote of the gentleman who said you had to smoke like 2,000 pounds in an hour for a fatal dose. And you have more problems than just smoking cannabis if you're smoking 2,000 pounds in an hour. So um,
Yeah.
there is no fatal dose of cannabis. There are much more common things that are actually much more dangerous. Obviously, we have alcohol, you have just over the counter medicines that are much more dangerous.
Yeah, I've heard actually the cannabis is safer than McDonald's hamburgers. But I think that's the important thing to understand is that you're not going to die. Now, if you do take too much cannabis, you can get drowsy, you can have some side effects. But the one side effect you're not going to have is you're not going to die. And I think that's the important thing to understand. Now, let's talk a little bit about the components of cannabis.
Yeah, certainly. So there are three main components of cannabis. You have the cannabinoids, and there's several of those that people already know. So the ones that people know are going to be THC, which is the psychoactive part of the cannabis plant, and then you have CBD, which is another cannabinoid that's the non-psychoactive part of the cannabis plant. There's also many, many minor cannabinoids. They just don't appear in large amounts in cannabis plants. Additionally, you have terpenes. Terpenes are what give cannabis its smell and its taste. So these terpenes are actually also bringing in a lot of health benefits as well. So, for example, linalool, also found in lavender, has that sort of sweet smell to it. Linalool is actually great for relaxation. And additionally, you have flavonoids. Flavonoids are similar to terpenes. They're going to contribute color, aroma, and taste to the cannabis plant. But again, they're also going to be bringing a lot of medical benefits, such as an antioxidant, anti-inflammatory, and possibly even disease prevention. So a big thing about cannabis is when you put all of those different parts of the plant together, so you have your cannabinoids, your terpenes, and your flavonoids, you end up with something called the entourage effect. That is how those different compounds work together to provide medical benefits.
It's really interesting. The 120 cannabinoids and 100 terpenes are very effective to helping people basically get their life back. We know that if we hurt our finger or hurt our knee or something like that, a signal is sent through our nervous system up to our brain, says, Houston, we have a problem. And then your body then tries to manage it. What the body was doing with it. And what happened was when we started studying cannabis, we found the endocannabinoid system, or referred to as ECS.
So when we think of endocannabinoid system, endo meaning inside, so this is naturally occurring within our body. And so our body, therefore, is naturally producing cannabinoids that interact with these receptors. The CB1 receptor, primarily located in the brain and the spinal cord, and then the CB2 receptors are going to be more in the peripheral organs of the body. CB1 and CB2 are just two of many different receptors that cannabis can interact with. And all of these different receptors are going to have slightly different jobs within the body. For example, the 5-HT receptor that cannabis interacts with is a serotonin receptor, and that's actually responsible for digestion, blood flow, and breathing. The A2A receptor is inflammation and coronary circulation. You have VR1, that's body temperature and pain. And then the GRP55 is responsible for blood pressure. So you have endocannabinoids interacting with many different systems in your body to help bring a sense of balance and a sense of equilibrium to your body, because that's what your body is always trying to do, is get back to that balance, that equilibrium. So endocannabinoids and phytocannabinoids are structurally exactly the same. meaning that when we are introducing phytocannabinoids from the cannabis plant into our body, we are supplementing the naturally occurring system that is in our body.
For example, like I'm a senior citizen, and I know that I don't produce endocannabinoids like I did before or as fast as I did before. So having some phytocannabinoids in my body, in essence, is recharging my battery. I think this is important because now what we found out is this is a very natural way that the body can really, really help itself heal. And we've known about this really only the last couple of years, but for thousands of years, it's been practiced, right?
Certainly, yeah, we have records of cannabis being used back in ancient times, and we are just now, within the last 30 years, figuring out why it works in the body and how it works in the body.
Sure.
So that research is new, but the benefits have been seen for thousands of years. Your body is going to be sending chemical signals all throughout your body, and that's really what the endocannabinoid system is. It's a chemical signaling system in your body, and we might not realize it, but that is going on in the background all the time. And so our body is going to use those phytocannabinoids from the cannabis plant where it sees fit. It's going to send those where the body is signaling it to go.
Yeah, and this is again all part of that entourage effect that we talked about. So really, what's the bottom line? I know that one of the bottom lines we talked about is it's safe. You know, you're physically not going to overdose from it. You maybe have some negative side effects, but those are easily counteractive.
Especially when I'm working with new patients, I like to explain that they are in control of this process. The dosing is going to be based on how they feel using the products. So if they feel that the dose is too high, okay, then the next dose, let's lower it. Let's bring it back down a little bit until you find that spot where you're comfortable without negative side effects.
Cannabis is very personalized. It's very much like alcohol or very much like caffeine. People have different tolerances and different ways of reacting to it. Your body will tell you how it reacts to it. The question is, how much do you have to take and what's your therapeutic dosing level? And that you can find out through a process called dosing that we use in the medical cannabis world. But you're in control, and I think that's the important part of it. Also, really, you can't get addicted to it.
We have thousands of patients that are using medical cannabis, and I've had personal interactions with lots of those patients that are telling me that they're able to stop these long-term medications that they've been on with the assistance of the physician that prescribed them that medication. But I've never had anybody tell me that they have not been able to stop cannabis. It is not addictive, and if somebody wants to stop, there's not going to be any withdrawal from stopping suddenly, nor will there be any cravings for the actual substance. People may have a psychological need to not be in pain, to not feel anxious, to feel relaxed, or to help them sleep. But that is not necessarily the same as an addiction. That is a kind of a physical need for the relief that the product provides.
I have 7 herniated discs in my neck, and I take medical cannabis to basically reduce the inflammation as well as the pain. And if I don't take any medication at all, my pain level can be a 7 or an 8. But using medical cannabis, I keep my pain level below a 1. I take about every 6 to 8 weeks, I take a day or two off just to let my body reset, the natural endocannabinoids in my body do its job, because sometimes they can get lazy. After about a day or two, my neck taps my shoulder and says, if you don't do something pretty quick, I'm going to let you know I'm here. I don't have any physical addictions. When I stop using cannabis, there's no negative side effects other than the fact that the pain comes back.
A lot of people are using it to treat a certain condition, and then when they're not able to treat that condition, they want to go back to treating that condition.
Sure. I had a perception when I got into medical cannabis that you had to smoke it. You really don't need to smoke it. There are other ways of taking it, like, for example, tinctures, edibles, vaping, and creams and lotions that can help you quite a bit. This is important for patients who want to be able to make it easy on themselves.
Yeah, absolutely. I really like to explain to patients that this process is all about making them comfortable in the choices that they're making. So if they've never been a smoker or they're a previous smoker and they do not want to inhale anything, that's totally fine. We want them to be comfortable with the products that they're using. And if they're not comfortable with an inhaled product, that's fine. We have lots of other products that they could try, including oral, topical, sublingual, or edible products. So there's a wide range of things that do not involve an inhaled product.
Right. And that includes some of the famous gummies, brownies, and things like that. If you're in Florida and you want to take a look at getting a medical marijuana card, I recommend MMTC, Medical Marijuana Treatment Clinics of Florida. They also help you once you get your card to get your dosing correct and be able to give you information about how to use it correctly. So, Amy, any final thoughts?
Yep, as always, I'm going to recommend start low and go slow with your dosing. I recommend keeping a treatment journal to help you figure out what's effective or ineffective. And then just knowing that there's options for products that you can use, but there's also resources that you can check out that are totally free. And we are just here to help you along this journey.